Welcome, everyone, to the People's Health Briefing, a key component of our Trusted Voices campaign. I'm Dr. Noha Abalada from Roots Community Health, reporting for the week of October 28th, 2024. As health professionals rooted in Oakland, serving some of the most marginalized communities in California, we're here to cut through the noise and bring you the latest information on health issues relevant to us all. The goal of the People's Health Briefing is to equip you with the best knowledge and insights to keep you, your loved ones, and your community as safe as possible. This week, I'm joined by my co-host, Shanice Smith, licensed clinical social worker, who will talk about behavioral health in the workplace. And I'll be reviewing some of the contagious illnesses we're contending with, including SARS-CoV-2, Norovirus, and Enterovirus. Starting off with SARS-CoV-2 and taking a look at wastewater nationwide, we can see that the concentrations are low and finally coming down in every geographic area. When we take a look on the map, we can see that most of the country is minimal in that palest color, or low or moderate, and only 2 states, New Mexico and Wyoming, are coming in as high. But we know this is really to give an overall sense. So if you really want to know what's going on in your area, you can look it up. And I posted what appears to be the best remaining resource in the post. And one good thing is that it's not only SARS-CoV-2 that they're checking in the wastewater, and I will give another example of that in a few minutes. Looking at the percentage of emergency department visits with diagnosed COVID-19, it is also still coming down. When we look over to the far right, though, we can see that it's not coming down quite as fast or as steeply as it has been for the last couple of months. It looks like it might be leveling off just a bit, but hopefully it will keep coming down. We wouldn't want it to level off here before it goes back up, but we'll just have to watch and wait and see. And next, taking a look at COVID deaths in the US. So we're still around the 1,000 deaths per week range. Since last week, when I reported, the number of deaths for that week ending September 21st was increased by almost 50 additional deaths. We know that that happens as the death certificates continue to come in. So that's something we've come to expect. But even if we just count the deaths that have already been recorded, since the beginning of August of this year, over 12,000 people in the US have lost their lives to COVID. So this is, of course, way too many people dying from this illness that is transmitted by the respiratory route, and that is continuing just to spread quite a bit. And we know that much of this could be prevented. The best way to prevent deaths or the most severe outcomes really are to stay up to date with vaccination and to access timely outpatient treatment if you're someone who should be treated. And if you don't know if you're someone who should be treated, then take a look at the list of conditions linked in the post. But even more importantly, have this conversation with your primary care doctor so that you can have a treatment plan lined up in the event that you need it. But being that we now have the 24-25 COVID vaccines available, and we'll be heading into the winter months where we know there's a lot of traveling and mixing and gathering indoors, this is a good time to be getting that updated vaccine if you haven't already. And of course, we want to continue to do what we can to prevent the spread of SARS-CoV-2, gather outside when you can, mask up if you're gathering indoors, improve ventilation and filtration in your indoor environments. And please, if you don't feel well, isolate from others and continue to wear a mask as you recover. And taking a look at SARS-CoV-2 variant proportions, KP.3.1.1 is kind of holding steady at about 57% of specimens estimated, while XEC is increasing. There have been some lab studies recently to identify why it has an advantage. I've linked an article in the post for those who are really interested in the technical details. But basically, it confirms what we already know, which is that it gets around our prior immunity even better than the other circulating variants. So it has an advantage that way. which is why it's doing such a good job at doing what it does, spreading around. And the good news is that our tests and our treatments and our vaccines all work against this variant, so the general advice remains unchanged. And now I want to briefly share a newer dashboard from the CDC. It's called the National Respiratory and Enteric Virus Surveillance System, and they have some new dashboards there. I've put a link to that in the post. And so we know, of course, that the respiratory viruses refers to those that are spread by droplets or through the air, and it gets inhaled into the lungs and it affects the respiratory system. Enteric has to do with the intestines, so I'll get to that in a sec. Starting with the respiratory viruses, this dashboard is showing about 8 different respiratory viruses, and it's pretty much showing out of all the positive tests that people took for respiratory viruses, what percentage are due to these different viruses. So we know that, of course, this is going to be a pretty limited sample of folks, but it will represent those who showed up for care and actually got a test. So we know this will include in the emergency department, in the hospital, and some outpatient settings as well. Of course, this won't include all the people that don't test, people that have mild illness and get better, people that do home tests, and so forth. But what this snapshot is showing is mainly that SARS-CoV-2 in the red is heading down, which is what we've just been going over in terms of the wastewater. And what is high and kind of increasing up there is that gray line, which you can see is labeled RV/EV. And what that stands for is rhinovirus/enterovirus. And this is kind of because the tests for these are a little bit similar, and you really wouldn't know which is which unless you got a PCR. So they're kind of grouped together. For the most part, rhinovirus is what we would normally just refer to as a common cold. And rhinovirus is in the same virus group as enterovirus. There are no vaccines or specific treatments for rhinovirus or enterovirus for that matter. And normally, rhinovirus is giving just kind of congestion and cough and sore throat. So basically a cold. And of course, people with underlying conditions can get sicker. Particularly people with asthma can definitely have a worsening of their asthma because of an infection with rhinovirus, so something to also keep in mind. And so we see that the RV/EV is on the rise, and like I mentioned, this includes enterovirus. And so this is what is referred to as non-polio enterovirus, because polio is also in this family, but these are the non-polio variety. And the one that seems to be on the rise currently is called enterovirus D68. It also mostly causes respiratory symptoms like runny nose, a cough, and sneezing. Infants and children and teenagers are more likely than adults to get this. Some people don't get any symptoms at all, so we know that there's asymptomatic infection, but some people can get pretty sick. And just like rhinovirus, there's no specific treatment or vaccine yet. And one of the bad things about this virus is that you can actually be contagious for kind of a prolonged period of time, even after you feel better. So folks can be contagious for weeks. There's also a rare complication that can happen weeks after the initial infection, and that can cause severe weakness, almost like a paralysis, like we see with polio. So this is very, very serious. Again, rather rare. So it's nothing to get too concerned about, but at the same time, it is something that we should all be aware of. It happens in the few weeks following the respiratory illness. So just something to keep in mind that after a cold, of course, we're going to hopefully be testing for COVID, because we know that COVID is still killing a lot of people, especially those who are more vulnerable. And so that is something that we want to really mitigate as much as possible and keep from spreading, because we know that that is incredibly, incredibly contagious. These viruses are contagious, not nearly as contagious as COVID, and they usually cause milder illness, But at the same time, if there is that not COVID, which we've been definitely seeing a lot more of these days, just keep an eye, especially on the kids. Few weeks afterwards, if there's anything like real weakness in the limbs or drooping of the face or anything like that, that would be a reason to get immediate medical attention. I'll plan to do a more in-depth overview of this virus in an upcoming briefing because it does seem to be on the rise this year. So just something to be aware of. For the most part, we're going to prevent the spread like we would with other viruses, but keeping in mind that this is not as wildly contagious as SARS-CoV-2 by the airborne route. But we do see surface transmission with this, so meaning, the high touch surfaces, close contact, shaking hands and then touching the face, all the same things that we know like from the flu. So hand washing is still important to prevent the spread of a number of things, including enterovirus. So they've been hearing about these respiratory illnesses, and it's not COVID. We're going to make sure we're testing while having symptoms. You probably want to get at least 3 good COVID tests in there to try to kind of rule it out every 24 to 48 hours or so. But if it's not that, then it could be rhinovirus. You could see at the bottom there's the yellow line that's starting to pick up. That's parainfluenza virus. Not seeing too much flu A and B yet, but we expect those to start picking up in the coming weeks as well. So let's just keep up all of our best practices to prevent the spread of respiratory illnesses. And also to do the hand washing, and in case you needed another reason to pay attention to the hand hygiene and cleaning the high touch surfaces, we can also see when we look at the enteric dashboard that norovirus cases are on the rise as well. So this is showing weekly tests. So again, these are people who actually presented for care, probably for symptoms of diarrhea or vomiting diarrhea. And then they actually got a test done and then came up with the norovirus. So we know that this is a smaller subset of people, but definitely if you get sick enough with diarrhea, you're presenting for care. And the main thing that we kind of worry about here would be if there's severe vomiting and diarrhea that could lead to dehydration and things like that. So that's something to keep a lookout for. But when we take a look at wastewater surveillance of norovirus, there are some areas around the country that are also seeing a big uptick of norovirus in the wastewater. So I wanted to point out a recent study that was done. It's linked in the post. It looked at 76 different wastewater plants in California. And what they did was compare the norovirus in the wastewater to this National Respiratory and Enteric Virus Surveillance System of the CDC. So they looked at wastewater and compared it basically to the test positivity data. So without getting into too much detail about their methods, they did basically find that there was a good correlation between the wastewater signal and the test positivity. And they looked at this for over about a year. So this was important because we don't want to just be looking at wastewater just for wastewater's sake. We want to know that it's providing some kind of good correlation, like we know that it does with SARS-CoV-2. And so now we have that confirmation. So again, if you're interested in what's going on in your area, you can check to see if they're monitoring for this, but it is generally increasing nationwide right now. And norovirus is the #1 cause of what we might refer to as a stomach flu or a stomach bug. It's very contagious. So it's usually the culprit when there's outbreaks like in schools or daycares or on cruises and things like that. And like I mentioned, the main concern we have with norovirus is dehydration from all the diarrhea and vomiting. So staying hydrated is really critical. And we worry more about this in the extremes of age. So our babies and our elders, we want to keep a close eye on them, want to make sure that they're staying hydrated, their mucous membranes look hydrated, and that, if they're just seeing like their level of awakeness is altered or they seem disoriented or anything like that, this is something where they might need, IV fluids or something. So just keep an eye if you've got anybody who is sick with a bunch of vomiting and diarrhea. And we may want to test to see what is actually causing it, even though, again, there's no specific treatment for this one either, but just more supportive treatment. And the big thing to keep in mind here is that we want to prevent those outbreaks. We want to prevent the spread within households as well. And with a little effort, we really can reduce outbreaks. So wash hands thoroughly, wipe down surfaces with a bleach solution. So the alcohol-based hand sanitizers actually don't work on norovirus. You need bleach. And definitely if you're running any kind of daycare or senior center or anything like that, then you want to really keep this in mind as far as how you are wiping down your surfaces. Also, cook your shellfish thoroughly. Those have been the culprit of some norovirus outbreaks too. When you're sick, don't prepare food for others. Also, you want to rinse your fruits and vegetables very thoroughly and wash those hands and clean those high-touch surfaces. Also want to share a little bit of late breaking news about H5N1, just published in Nature. I linked the article in the post. Basically, they isolated the H5N1 from a sick dairy worker, and they did some experiments on it. So this particular worker had gotten the H5N1 from a cow, and they ended up with the conjunctivitis or the eye infection. And they actually isolated the virus from the eye of this dairy worker. And so we know that what we've called bird flu for some time now is spreading among mammals, and there's a particular mutation that has been identified in the H5N1 virus that replicates in mammals. So they did a number of different investigations with this virus in different types of tissues, and they confirmed that it can indeed replicate in respiratory tissue. They also found out that it can transmit among ferrets through the respiratory route. So that is not a good piece of news. They basically found out that it could be spread respiratory route from ferret to ferret. Also, it was 100% lethal in these ferrets. Also not at all good news. So ferrets are actually considered a good animal model for us to study influenza viruses. And unfortunately, when they tested this variety of the H5N1, it killed all the ferrets. When they tested the H5N1 that was from the cows, it did cause illness in ferrets, but it did not kill them. But unfortunately, like I said, this one that they isolated from the eye of the human who got H5N1, it spread from ferret to ferret and it killed them all. So as this virus continues to spread and really kind of progress forward in its spread and who and how it's spreading and who it's spreading among, I think we're getting more and more confirmation that we should be doing everything we can to contain the spread of H5N1. So now I have the pleasure of handing it off to Shanice Smith, licensed clinical social worker, to talk about behavioral health and specifically behavioral health in the workplace.
Hello, everyone. My name is Shanice Smith, licensed clinical social worker. I'm the clinic manager over the behavioral health services and programs at Roots Community Health. I'm going to go over some information about mental health in honor of October's Mental Health Awareness Month. We know we celebrate in October, but we all know that mental health is important all year round and all throughout our lives. So what is mental health? Mental health includes our emotional, psychological, and social well-being. It affects how we think, feel, and act, and it's important in every stage of our life from childhood to adulthood. It's good to note that everyone has mental health, just like everyone has physical health. It's just a state of your mental well-being. So why is this important? Well, one, it's because we all have it and we're all having to deal with it. Mental health affects every aspect of our lives. Good mental health can help us manage our stress, relate to others, and make decisions. But when our mental health is neglected, sometimes these challenges can cause serious conditions, but also serious disruptions in our everyday life. So we want to make sure that we can recognize some of these signs of mental health, specifically when we are at work. October is Mental Health Awareness Month, kind of specifically highlighted our mental health in the work setting. So some common signs to look for if you might be struggling with your mental health at work is physical signs, so fatigue, frequent illness, changes in your appetite. So you could be eating more food, eating less food. You could possibly even be skipping meals, skipping breakfast, skipping lunch. Emotional signs, irritability, mood swings, feeling detached from your work, feeling detached maybe from your team and other staff members that you work with. Cognitive signs, difficulty focusing, forgetfulness, and reduced creativity, and maybe even difficulty processing information to complete tasks and roles and responsibilities. The impact on employees and employers. Our untreated mental health issues can result in a lower morale, strained work relationship, and higher turnover. It can also feed into burnout that employers and employees can experience. So why prioritize our mental health at work? Well, the average American works around 34.4 hours per week, according to the Bureau of Labor Statistics, which includes full-time and part-time employees. So over a lifetime, assuming that we're working a 40-hour work week, we know sometimes we work more than that. And if we're working from, let's say, the age to 18 to 65, and we know some people work longer than that or start earlier than that, the average person will spend over 90,000 hours at work. 90,000 hours at work. So given these numbers, it's easy to see why prioritizing our mental health in the workplace is crucial, because it takes up a majority of our life and our time. A lot of our time is spent at work, around our colleagues, and doing the work that we do. And so it's very important that we are checking in our mental health and taking care of ourselves, even when we are in the workplace, and specifically because we are doing so much work. So benefits to employers. It benefits both employers and employees when we do have great mental health and good mental well-being. There's improved productivity. So employees who feel mentally well will perform better. There's reduced absenteeism. So supporting mental health leads to fewer sick days and call outs. And then the lower turnover. Employees are more likely to stay with a company that values their well-being. And then the benefit to the employee, better work-life balance. Encouraging mental wellness improves your quality of life. So being able to take care of yourself when you leave work, in the evenings, on the weekends, and even during work, right? Making sure you're getting up and taking walks and taking breaks. And then increased engagement as an employee. You're more motivated and you feel more supported when you have good mental wellness in the workplace. So how can employers support mental health for their employees? Create and promote a culture of openness. So normalize conversations about mental health, reducing the stigma so employees feel comfortable saying like, hey, I'm going to take a mental health day, or hey, I need a mental health day. Encourage employees to share when they are struggling and ask for help. So allowing employees to have time to speak to management or leadership or staff and just kind of speak about what's going on with them. Provide mental health resources, so offer employee assistance programs, so EAP programs for counseling and support. Share local resources, whether that's in Oakland or community mental health centers, and maybe even support groups. So having that information on hand, even helping and supporting staff with navigating their insurance to understand their mental health benefits can be very helpful. And then workplace initiatives, implement mental health days or flexible scheduling to promote balance. Train managers to recognize signs of mental health struggles and offer support. So even leadership taking mental health days and saying like, hey, I'm gonna take a mental health day, that can encourage staff and allow staff to know that they have permission to do that as well. And then the flexible scheduling. Sometimes we're in meetings all day, so it's nice just to have admin time, or just being flexible with the schedule, starting later in the day or getting off a little bit earlier can be ways that we support the mental health of our employees. And then employees, taking care of our own mental health. So knowing your limits, setting boundaries and taking breaks when needed to avoid burnout. So if you know like, hey, after 2 or 3 meetings, I need to get up, I need to get some fresh air, I need to get some sun, making sure you take that time to walk, to just stand outside, to really get grounded. Use the available resources. So if you do have insurance or mental health benefits through your employer, using those, really following up with the things that are offered to you. Take advantage of therapy, take advantage of the EAP programs and any community resources. And then create healthy habits. Practice stress management techniques like mindfulness or exercise and regular check-ins with yourself and others. I know some teams like to go work out, after work together, taking a walk maybe in the morning before work, or just even if it's by yourself, just creating those habits so that you feel the best when you walk in the door for work. So let's make mental health a priority. Our call to action is whether you're an employer or employee, let's commit to making mental health a priority in the workplace. Reach out for help when needed. Taking care of your mental health is not just a personal responsibility, but a community priority. Because when one person feels better, that can create someone else feeling better. And as a community, we can then feel better together, which would be great. Thank you so much, and happy Mental Health Awareness Month. And again, we should be aware of our mental health, checking in on our mental health every day of the year, and just making sure that we are doing all right. So thank you.
I always appreciate Shanice's contributions, not only to this briefing, but just to the Roots community, to the community in general, to our teams, to our patients. And I also really appreciate that this year's focus was about mental health in the workplace. I just wanted to add another note to this, especially since I know that many of our viewers are in healthcare or behavioral health or public health, or your community health workers or coaches. Of course, at Roots Community Health, our amazing staff of almost 250 people are working tirelessly to keep our community safe and healthy. And whether you're providing therapy or you're caregiving for a family member, or you're providing primary care, or you're a health coach, or whether you're a biller, whether you're a coder, or whether you're reviewing notes or writing reports, all of this, any of this can be very challenging. But especially for the people who are day in and day out working with patients, or going out to the encampments, or providing medical care or behavioral health care, sometimes it really can take a toll. And so I just wanted to briefly mention something called vicarious trauma. Vicarious trauma is also sometimes called secondary trauma. And it's talking about the emotional toll of being exposed to the traumatic experiences of others. So even if you personally did not experience the traumatic event, it's like you're absorbing the trauma from hearing about it. And it is a very real thing. And you don't have to be a healthcare worker or a mental health worker to experience this, but those folks are at increased risk because, of course, of the repetitiveness and how many different things they're exposed to just in the course of a single day, let alone day after day after day. And it can manifest very much like direct trauma. It can look like being depressed or numb, or being irritable or anxious, or just being really negative or hopeless. I could do an entire briefing about this, maybe I will, but for now, I just wanted to bring up that this is something that we should all be aware of for ourselves, for our loved ones, and especially after everything we've been through with this pandemic, let alone just all of the other challenges that folks are seeking help for every single day. And there are a number of things that can be done within the workplace and just in your individual personal life to try to mitigate this. I won't have time to get into all of this today, but I just wanted to bring it up just to remind us that sometimes the healers need healing and the caregivers need care. And sometimes those caregivers in our lives are the ones that just seem so strong, taking care of everybody else. And just remember that they need care too. And just remember that vicarious trauma is a real thing. And sometimes just checking on someone can mean more to them than you know. So just to recap, SARS-CoV-2 continues to trend down. Hopefully it will do so for a while longer before going back up in the winter. We expect flu to start picking up in the coming weeks. And we know that we are already seeing some increases in rhinovirus and enterovirus. H5N1 continues to progress in terms of its transmission between mammals, including humans. And in addition to all the contagious illnesses that affect the public's health, we also know that mental health challenges are an important thing for us to be alert to, so we can take care of our own mental health and also so that we can support our friends and families and coworkers. A couple of final notes. We will be off next week because Roots Community Health observes Black Solidarity Day. This is observed the Monday before Election Day to remind us of our collective strength and political and economic power. Black Solidarity Day was established in 1969 as a collective call to action of people of the African diaspora to abstain from work, school, and commercial activities, and to instead focus on upliftment of our own institutions and community. Black Solidarity Day is observed in many cities across the country, as well as in institutions of higher learning, including many historically Black colleges and universities. And this year, Black Solidarity Day will fall on next Monday. And so as a result, we won't be having a briefing on the following day, which is Election Day. So I hope that everyone will be out there getting their voices heard by casting their ballots. We will be celebrating for the entire week, Black Solidarity Week. So I encourage you to follow us on social media at Roots Empowers to join us for activities of upliftment and economic empower and multiple opportunities to show your solidarity. So in the meantime, please take good care of yourself and one another, and we will see you on Tuesday, November 12th. See you then.